Good morning, Good morning, everyone. I'm sorry. Stay way far away from it. So. Good morning. Today's October 14th. My name is Colleen Whitlow. I'll be chairing the meeting today. Jeff is agenda for Arapahoe. So with that, we'll ask for any public comment at this time, online or in the room, that would like to speak to.
Okay, thank you, Madam Chair. I will give it a moment to see if anyone raises their hand online or in person. Seeing none, back to you.
Thank you very much. Next on our agenda is August 19th, 2025, Regional Transit. Are there any changes or discussion on that? We'll move on to our first action item, amendments to the 2026-2029 Transportation Program by our Senior Planner, Swank. At the podium.
All right, thank you, Chair. So we just have a pretty simple amendment for you this morning. So back in 2008, the DRCOG board committed $50 million in a second commitment in principle to the Fast Tracks program, and funding was set aside for 11 specific corridors. To date, 10 of those corridors have requested that funding, and this morning we're bringing the 11th and final corridor to you. So the City and County of Denver and RTD submitted a joint letter, which is available in your packets, requesting to utilize the funding for the Central Corridor Extension Project, so $771,000 federal, for a study to look at alternatives along the Central Corridor route in Central Denver. So the amendment before you today would be to take that funding from the second commitment to Fast Tracks project in the TIP and apply it to a new Fast Track Central Corridor Vision and Alternatives Analysis Study project. So with that, happy to answer any questions committee members may have. Otherwise, I do have a proposed recommendation available for you.
Questions or comments? Director Guzman.
Please describe the corridor.
Yes, so the Central Corridor is today's L line, so running up, the final extension corridor would run up Downing, so from the current terminus of the L line up to 38th and Blake Station, excuse me. So this is to look at potential alternatives along this corridor, potential implementation of the originally planned rail, potential enhanced bus service, or other alternatives, looking at what the community may want, recognizing that it has been 2 decades since the Fast Tracks plan was initially planned.
Thank you. Do you anticipate having any further engagement when this line was being planned originally? The First Lady, Wilma Webb, really came out strong against completing the entire corridor. There is a discussion going on currently with the City and County of Denver, the community, about whether to finish the last 1 mile of that track to connect it to the A line. So I'm curious if you have any idea whether we would see negative commentary along that corridor to finish that project if it were to go to rail, or if you have some sense of where we're at in terms of alternatives.
I think that is the purpose of the study, is really engagement is central to it. So looking at neighbors and businesses along the corridor, as well as riders, and then determining what the final solution might be for that corridor, whether that is actually implementing the rail, whether that is using some sort of enhanced bus service and removing the rail, but really centering the community's desires for that corridor.
Okay, any other comments? Recommendation to move recommend to the Board of Directors the attached project amendments.
So moved.
I'll second.
All in favor, say aye.
Aye.
We get the microphone back to someday. Thank you very much, Josh.
Thank you.
Next, we'll move on to Transportation Demand Management set aside by our Division Director of Communications Marketing, Steve Erickson. Sir, you have the podium.
Thank you, Chair, and good morning, everyone. I'm Steve Erickson. I'm the Communications and Marketing Director here at DRCOG. To present funding recommendations for the 2026-2027 Transportation Demand Management Set-Aside, I'm happy to introduce Nisha Mokshagundam, who is our Way to Go manager. Nisha?
Right. Good morning, everyone, and thank you so much for your time today. I really appreciate the opportunity to share our recommendations for this set-aside funding. As Steve introduced me already, I won't spend too much time here, but I do manage the Way to Go program here at DRCOG, and I wanted to mention that Way to Go is a partnership between DRCOG and 8 transportation management associations that represent the 9-county region in various areas. The primary goal of our program is to reduce single-occupant vehicle use to improve traffic congestion and air quality. And one of the ways we achieve this is through the administration of the TDM set-aside, the Transportation Demand Management Services set-aside grant. And this was established by DRCOG's Transportation Improvement Program. So this funding is allocated toward projects that reduce the number of miles people travel in single-occupant vehicles. And project applicants are asked to show that their proposal will reduce single-occupant vehicle use through outreach, education, research, and communications, related to options for non-single-occupant vehicle use. Past projects, just to give you a little bit of an example of past projects that we have funded, they include things like feasibility studies. For example, we have had applicants look at the feasibility of implementing microtransit services within a service area. We have also had programs that communicate and provide outreach around e-bike libraries and infrastructure. So just to give you a couple of examples of projects that we have funded in the past. So the 2-year funding cycle, which covers 2026 and 2027, has $1 million, and that was made available in addition to $95,000 in returned funds from a past TDM services set aside. Applicants were required to submit an early letter of intent to establish their project proposal and project parameters, and then DRCOG staff worked with prospective applicants to refine those applications and project proposals before final applications were due. And after the applications were submitted, they were reviewed by a panel of internal DRCOG staff as well as some external partners. We'll talk a little bit about that in a couple of slides. But first, just wanted to talk about who the review panel consisted of. So we had 8 members, 5 from DRCOG. We had staff from communications and marketing, as well as an employee from the transportation planning and operations side. And then we had 3 external panel participants, one from the Colorado Department of Transportation, one from the Regional Air Quality Council, and then finally one from a TMA partner that is outside the DRCOG region. And I want to mention, too, that the criteria that we looked at as the panel were potential vehicle miles traveled reduction. So that was really the primary criteria we were looking for. But we also looked at things like, is this project proposal innovative? Can it be replicated outside the region? Is it unique? And what is the effectiveness of the funding? Here is just an overview of the timeline of the application process that was followed by both the panel as well as project applicants. So we kicked things off with a mandatory application workshop in May. And then, as I mentioned, as those letters of intent came in, DRCOG staff worked very closely with project applicants to refine the scopes of each proposal. We finally asked that applications be submitted by July 3rd, and the panel then was sent all of the applications, a score sheet, and asked to review, rank, and score each project. The review panel had 2 weeks to do that work, after which point we met together, we discussed every panelist's scores, and then we came up with our recommendation. We did recommend that we fund all 7 projects, and we'll go through all of these in just a moment. So in the next couple slides, I'm going to summarize each project, and you do have all of these outlined in your packet if you'd like to follow along. So we'll start out with Transportation Solutions. They are actually a local transportation Transportation Management Association and Way to Go partner. And their proposal seeks to target workers in Cherry Creek with information about alternatives to driving alone. This project will coincide with an influx of commuters traveling to the community where parking minimums have been reduced and paid parking is quite common. Northeast Transportation Connections is also a Way to Go partner. It's a transportation management association, and their proposal seeks to evaluate strategies and look at the long-term feasibility and funding options to provide multimodal options to travelers using the 61st and Peña and 40th and Airport RTD stations. Commuting Solutions, which is also a Way to Go TMA partner, intends to use set-aside funds to support a new development, Harvest Hill in the Northwest region near US 36 and Broomfield RTD stations. So Commuting Solutions proposes to put together linguistically and culturally relevant education materials highlighting non-solo driving options. We also have Boulder Transportation Connections, another TMA Way to Go partner, and they have proposed an education and outreach initiative to promote neighborhood eco-pass. I do want to mention that this program will support Senate Bill 25-161 transit reform, which requires greater promotion of RTD's pass programs. The Denver Regional Mobility Access Council has sought funding through the TDM set-aside as well, and they would use that money to increase the scope of its existing travel training program. So these additional funds would be applied to strategies to identify and target members of underserved communities, including older adults, to receive education on alternatives to driving alone. Community Cycles in Boulder would like to use set-aside funds to develop a communications and awareness campaign to highlight the US 36 multi-use path and also champion use of new bicycle infrastructure, which is currently under construction along Highway 119 from Longmont to Boulder. And then finally, the Downtown Denver Partnership, another Way to Go TMA partner, is looking for funds to develop a media campaign to promote multimodal transportation options for commuters to downtown Denver. And this initiative will support downtown employers whose staff are returning to in-person work at a physical office. So the motion before you today is to recommend to the Board of Directors that these recommended projects be funded through the TDM services set aside of the DRCOG 2026 and 27 Transportation Improvement Program. And with that, I'm happy to take any questions.
Questions or comments for Nisha? Mark.
Good morning. Thank you for the presentation. I have 2 quick questions. The first is, you referenced that a number of these groups are existing TMA partners. I was just wondering if you could describe what that means.
Yeah, absolutely. So the Way to Go partnership, again, consists of DRCOG and these 8 Transportation Management Association partners. They represent geographically specific areas within the region, and I think one of the benefits of that is they're really able to build strong community ties. They're able to really understand the neighborhoods that they work in, and we have a really robust partnership where we meet with the TMAs several times a month. We work very closely with them to establish joint goals as a program.
Got it. Thank you.
Sure.
And then the second question is just, as these different proposals are implemented, can you describe kind of what is the, I'm assuming through your program, like what's the accountability for that? How do we measure the actual impacts of these campaigns?
Yeah, this is such a great question. So all of our project applicants are required to send high-level monthly updates, but they're also asked to provide mid-project reports that will talk about the outcome of their program. At the end of the funding cycle, they are asked to provide a closeout report, which will, as I mentioned, VMTR is really the primary metric that we're looking at, and this closeout report would include an actual number.
I just would like to chime in. I chair the Board of Transportation Solutions, which will be receiving some of these funds, so I'm going to abstain on this vote. But I would just say from that perspective, this work really matters. The work that your team is doing makes an impact in lives. When we sort of get down to the TMA level, all of the macro habits and choices that we as a group try to change, this does it. This does it in a way with outcomes that you can see that somebody who's changed their commuting patterns for the rest of their life. So thanks to DRCOG for being such a great partner to all the TMAs. And again, I'll have to abstain when we take a vote.
Okay, good. Questions or comments? Oh, Director Guzman.
Thank you. Ms. Mokshagundam, thank you so much for including accessibility in this study and in this work. Requiring that's going to be pivotal to making sure communities understand what's going on and what we're trying to do here. So through all of these, knowing that that's going to be a part of it, I appreciate it, and taking care of 50% of our population that don't speak English or have limited English proficiency should be really helpful.
Very much. Heather? So the proposed motion is to recommend to the Board of Directors that the recommended project to be funded through the TDM services set aside at the DRCOG 2026-20 Transportation Improvement.
So moved.
Second. All in favor, say aye.
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 Abstain.
All right. Thank you very much, Nisha.
Thank you.
Steve. All right, we'll move on to our Transportation Improvement Program, programming year adjustments by Project and Program Delivery Manager, Todd Wichel.
Thank you, Chair. Good morning, everyone. So just to give you a little background before we get started. So I was last here in June outlining this item, and that actually did look a little different because not more than a week or two after we had that discussion with you, I think we also had it at the board the next night, our funding sort of fell apart a little bit. We were notified of some funding reductions, which sort of made us think internally, what is the best way forward? And it did change sort of our thought process at that time. So we took that opportunity to really go back and think about what is the best way to sort of go forward with our proposal and how it best fits within the region. But first of all, why are we here in the first place? So federal law says that the Transportation Improvement Program implements the Regional Transportation Plan. So that's encoded within federal law. And of course, from the local DRCOG perspective, our TIP applications reflect the RTP investment priority. So all of the projects that the applicants go through, they must look at their project proposal through the lens of those 6 investment priorities. It's not our fault. Sometimes these things happen, but and I knew Doug was going to like that. Historically, both of these documents have sort of been on very similar timelines, and it was nobody's fault. It just sort of happens. Typically, the TIP is updated every 2 years, though calls for projects are every 4, and the RTP historically is every 4 years, though that has shifted a little bit. Perhaps sometimes it's 3, but most of the time it's 4. So the last several times we've had an overlap where the TIP projects being asked for you to approve were contingent on the RTP also being adopted. And that's not necessarily the best way to go forward because we would really like those priorities set within the Regional Transportation Plan first before you select projects in the TIP based on what the RTP says. So we've taken a little bit of step back and really thought through this process to better align those 2 plans so they operate like they should. With that, we've come up with two sort of one-time recommendations. So the first would be to shift the next TIP cycle. So like I said earlier, we do adopt a TIP every 2 years. However, every other TIP, we hold that call for projects. So our current TIP covers 26 to 29, so that next 2-year TIP would traditionally cover that 28 to 31 period. However, we would recommend to shift that by 1 year so it covers federal fiscal years 29 to 32. What that would do is allow the RTP to continue as it is. If you're not in tune with exactly where that is in the process, they are going through their calls for projects right now, which ends at the end of this week, and they are ultimately looking at adoption for next fall. So it will allow that process to continue while we work through sort of the policy side of the TIP, and then begin those calls for projects shortly after. So that timeline, if we were to shift the next TIP to 29 to 32, maybe in a couple months or so, we will kick off those policy discussions. Those calls for projects will happen in 2027, again, after the RTP has been adopted. And then, of course, follow that in 2028 with eventual adoption. The second recommendation that we would have for this is how to program federal fiscal year 2028. So our last call for projects, it stopped in 27, and if we were to go through with this recommendation, that next TIP would be 29, essentially leaving 28 sort of a whole and unprogrammed. So we are putting forth recommendations on exactly how to program that. First thing we would recommend is to basically extend the existing set-asides by 1 year. That would cost $11.5 million in federal funds. So those who rely on those TIP set-asides in that 24 to 27 period, we would simply just allow 28 to be funded with 1 year at those current levels. Getting back to what I was saying earlier in this conversation about federal and state funding reductions that sort of made us rethink this process, we would use those FY28 funds to backfill all of those sources of funding without voluntarily reducing or eliminating funding to those existing projects. As of right now, that stands at approximately $26 million. I do want to caution that that may change and shift over time, but as of right now, that is $26 million. And of course, with those remaining funds, which is again, approximately $48 million, we would use that towards that 29 to 32 call for projects, which is actually a little bit of a benefit to us because typically when we do have requests in during those call for projects, there is a lot more funding that is requested in that first year of a TIP generally than what we can fund. We historically have pushed those off a year or two just because we don't typically have enough funding. So this could actually provide a benefit to a lot of projects being able to fund in 28. With that, happy to take any comments or questions you have, but there's a proposed motion here up on the screen.
Questions or comments for Todd?
Yes, thank you, and thank you for the presentation. As a recipient of one of the set-aside, I'll follow Skylar's lead from the last presentation and be abstaining from a vote, but supportive of the path forward here. So would work on Dr. Cog's behalf to get all these things in alignment. When would this 1 year kind of carry forward kind of idea, when would paperwork and things begin to be necessary?
Technically speaking, CDOT would not have access to those funds until July 1st of 27. So probably very shortly after that is when those funds could be available, and therefore you could amend any contracts that you have to add that extra year of funding.
Thank you. Perfect.
Other questions or comments? Motion. Recommend to the Board of Directors exceptions to the adopted policies for the TIP program development document to shift the future fiscal years 2020-31 TIP to 2029 to 2032 and to allocate fiscal 2028 funding as noted.
Second.
All in favor, say aye.
Aye.
Any abstains? Abstains. Thank you very much, Todd.
Thank you.
All right, we'll move on to our discussion items today. Multimodal Supportive Local Development Toolkit. This will be presented by our Senior Planner, Cole Netter.
Hi, good morning, everyone. My name is Cole Meter. I am DRCOG Senior Transit Planner, and I am here today to present on a project we are currently working on, DRCOG's Multimodal Local Development Standards Toolkit, more simply known as Built to Move. Here's just a quick agenda of what I want to go over about the project today. I'll give a quick overview of the project. This is a toolkit implementation focus, so I want to go over the components or the outcomes that we're looking for in this project, anticipated outcomes, and then a project timeline, opportunities and roles for you guys to participate in this project as well. And then I do want to facilitate at the end a little bit of a discussion of what the toolkit is and any questions that you guys might have going forward about the project. So just as an overview, as we all know, communities across our region are always working to create more safe and connected places. And often that means our transportation and land use decisions must be coordinated together. When these decisions are made more in silos, achieving more multimodal, connected, and accessible communities can be a little bit more challenging. This leads us to many of the existing challenges that we see across our region today. That includes coordination efforts between land use and transportation, as well as a lack of regional development design guidance that is context sensitive, meaning it's applicable to more urban, suburban, and rural environments. And finally, to address these issues, we often lack the staff time and capacity to study, adopt, and also implement best practices in land use and multimodal friendly approaches. The Built to Move toolkit wants to address these challenges by building local capacity and aligning land use and transportation efforts across our region. And at a high level, while creating this toolkit will provide clear, aligned guidance that strengthens multimodal access through our local development standards. And this means building capacity and understanding within DRCOG on development and design best practices, as well as better understanding our current development conditions across our region, more of an existing conditions report. And to achieve this, a major part of this project will include ongoing engagement with local communities in order to create a toolkit that's relevant and useful for our local government staff to use in real-world conditions. And that leads us to some of our toolkit components. What specific components will this toolkit include to achieve the goals and outcomes that we're going over today? So an important starting point that we're working on right now for this toolkit will be establishing a typology framework that is relevant to all types of community contexts within our region after going over suburban, urban, and rural environments. We're conducting comprehensive analysis on our member governments' zoning codes, their development ordinances, development patterns, and any kind of zoning code overlays that they might have. We're also ensuring alignment with existing DRCOG tools when creating this typology that use the typology approach. The Complete Streets Toolkit is one of those good examples that we have adopted at the moment. So using that data that we've collected, we're putting together case studies of successful multimodal developments across our region to learn from our peers about what is working and also what is not. Most of these will take place through direct engagement with our local community staff through focus groups that I'll go over in a little bit here. And this will help us develop some key takeaways on different development approaches that are already being implemented across our region. Design and development standards. So finally, a major outcome of this project will provide a range of context-sensitive design and development standards that our member governments can use in practice. And these tools, considered templates, case studies, and general guidance, will help achieve better outcomes when we are developing multimodal and accessible places across our region. As far as next steps go, there are multiple opportunities to participate and engage in this project, both as staff and elected officials. We want this toolkit to actually be relevant and helpful for member governments, not just be a plan that sits on a shelf after we've created it. And that's why we are conducting multiple focus groups with our local government staff grouped into 4 different typologies so we can gather feedback from as many different member governments and as many different contexts as possible. We are also later on in the project conducting a developer roundtable where member governments can engage directly with developers to address challenges and common themes across the region. They can share knowledge and also identify future opportunities for collaboration. Again, we want to make this toolkit as relevant and as applicable as possible to our member governments. So this engagement portion of this project is going to be incredibly important and ongoing throughout the entire duration of the toolkit. And this is our project timeline. We've gone over and submitted most recently draft corridor context and also putting together an existing conditions report, gathering a lot of that data from our member governments, as I said before, their development codes, development ordinances, and land use strategies, and also comprehensive plans and how they align with those. Task 3 that's starting up this month. We're beginning to reach out to member governments to put together focus groups, which we plan on meeting with each of the 4 focus groups 3 different times starting next month throughout the project. And then, of course, as I said before, we're going to be doing that developer roundtable probably early 2026. Task 4 is the implementation strategies. That's more on the DRCOG staff side. What we can do as staff to distribute this toolkit to different member governments and making sure that the toolkit is relevant and applicable to member government staff. It's actually helpful for them as well, and how we engage and how those member governments implement it going forward. And with that, that leads us into, thank you, but also discussion items and any questions that you guys might have about the toolkit. And then also just the overarching question, as we develop this toolkit and we'll be doing this engagement going forward, what is most relevant to all of you? What are the challenges that you are facing at the local level? I want to facilitate that feedback today and also, of course, ongoing through this project. Thank you.
Well, before I get to the questions, I apologize for mispronouncing.
Say again, sorry.
I mispronounced your last name, I apologize.
That's totally okay, everyone does that.
We're full today. Dr. Guzman?
Thank you. Are there considerations for language and cultural sensitivities in it? Because I think depending on the community, that might be a part that you need to consider, more feedback than anything. Who are the peers that you referenced? Because you said within the region, but what does that mean? Are we looking at projects that are solely within the DRCOG that have been well-defined and implemented, or are you looking at other places as well? I just want to make sure I understand.
Absolutely. So that's 2 parts. First one, and I didn't mention this in the actual presentation, it's shown up here. We do have pop-up events that are specific to members of the public, because we also do want to do components of public engagement on this, on why people are living where they are, and is transit, for example, or any kind of multimodal connectivity accessible to them in those areas. For that reason, we must ensure, given the wide breadth of communities that we have in this region, that our materials and the way that we are engaging is equitable and accessible as well. So that is an intentional part of this project that we're going through. You're going to have to repeat the second part of that question. Forgive me.
Who are the peers that you referred to, or what does that look like? Because I don't understand the definition.
Definitely. So at a high level, that is any member government that wants to participate and is an active participant with the focus groups in that project. So we are going to be intentional about reaching out to as many member governments as possible, given, again, the wide breadth of the type of communities, whether it's development pattern, the community members that live there. We're going to reach out to as many as possible to get that accessible and equitable feedback from them as well. We are splitting up different types of communities. Like I said, that urban, at a very high level, but urban, suburban, rural format, we're splitting them up into 4 different buckets, which when we have those finalized, I can present to you guys here as well. We're doing that because we want the different contexts of this to be relevant to them as well. For just as a good example, the town of Bennett is not going to find the guidance that we give the city and county of Denver the same. They're not going to use it the same, and they have different contexts that they have to deal with. So we're going to acknowledge that. But just with the outreach method that we're doing, we're going to reach out to as many as possible and to whoever wants to participate.
Two questions. What kind of tools were you thinking of putting into this, or is that part of the process and the development of this project?
You gave me an easy out. It is part of the development of this project. With that being said, it can range anywhere from specific zoning code templates that we can put together to just basic guidance on like a permitting process, for example. We see a lot of this coming out of the developer roundtable and them engaging with each other, finding common ground in those areas as well. But a major component of this is we did not want to draw that conclusion of what's useful early in this project because we, in reality, DRCOG staff are not at the local level actually doing the development work. That is the staff. So as long as we engage them successfully, we are going to make sure the toolkit is tailored to their specific needs.
That kind of leads into my second question a little bit, is the existing conditions, is looking at what the zoning standards and what's available in there, not necessarily what current conditions of multimodal options are in different communities. Is that correct?
Correct. And I'll give you kind of just like a basic example because we just received our data collection portion of the analysis on what we're doing on existing conditions. We looked at comprehensive plans. We looked at overall zoning code, the last time we've updated it, anything, for example, like parking minimums or maximums, whether they exist in that community, TOD overlays, anything like that. We're going to take those and we're going to find different interesting components of the different member governments and what they have. We're going to take those to the focus groups and engage those staff directly. And we want them to give direct examples of specific projects, of what worked because of a specific modification in their zoning code, for example, and what didn't. That'll come out of that best practice report and case studies that we did earlier. Also, that is not only tailored directly towards our region, but that'll be a major component of it. There's other examples elsewhere outside of the state, outside of our region that we want to use as well, but we're going to mainly focus that in from a regional perspective.
Thank you.
Commissioner Cook, did you have a question?
Okay, thank you. Cole, one quick one about the corridors. Is that defined? I mean, is that mainly transit corridors, or is that, you know, kind of piggybacking on what Darius talked about? Are those corridors where you want to see multimodal development, or how do you define that?
It's corridors that provide the best examples of what we have at the moment. And we're looking at that. I use the corridor typology as an example because we're trying to align it with the typology that we have in the Complete Streets Toolkit, because we want our toolkits to align as a general rule. So we are basing a lot of the work that we're doing off of the existing typology in the Complete Streets Toolkit. With that being said, it's more of a community-wide look of what characteristics and development patterns does a community currently have, and what methods could be used to improve those characteristics to make those communities more connected and accessible.
And that's true in task one, as you identify, okay?
Yes.
Then the second thing is this is meant to help communities who are working to comply with 1313 as they densify, and so the toolkit will include techniques or strategies or, you know, measures that they might take to densify in a way that really enhances multimodal access.
Yes, and that will definitely be a component of this toolkit. I do want to be clear that that is not the legislation that is used from the state is not the only focus that we have on this toolkit. It is a wide range of opportunities that they can use as a local level. This is also not a regulatory tool or any kind of reaction to any kind of regulations that we have from the state level. This is guidance, and we want to make sure that it is as helpful as possible to our local communities, especially ones that are constrained at capacity at the staff level that, like I said, lack that capacity to research and conduct analysis on zoning codes. Look at it more of that we are doing that for our communities.
Yeah, it seems like it'll be a great resource. Thank you.
Thank you. Jacob.
Yeah, thank you, Chair Whitlow. So this is a really important project. Cole, really appreciate your presentation. We've been talking about it a little bit in a theoretical way today, and I just want to ground us a little bit with some real world examples of what exactly this is and how important this is. Have you all ever had the experience where maybe you take transit, or maybe even you drive somewhere and you get off the train or you get off the bus or you park at a place and you're going to one place and maybe there's the coffee shop down the street that you feel like you look at Google Maps, like I should be able to get there, but I can't, right? Because there's a barrier, there's not sidewalks, there's something in between, or you drive to park at one place and you miss the driveway, and so you go one too far, but then you can't get back out and around. You know, examples like that. This is really what we're talking about, is how can we better connect our land uses in a multimodal way at the local level to have better connectivity and better mobility for everyone, regardless of the mode you're taking, regardless of where you're going, that connective tissue of how our land uses connect and relate to each other. That's really, I think, what we're trying to get at this project. Is that fair, Cole?
Yes, absolutely.
Thank you. And thank you, Cole, for this presentation. And I'm geeking out a bit as a planner and a housing developer, so I'm going to try to limit my comments, but I have a ton, and maybe I'll just reach out to you afterwards as well. First, a big picture question, and then a couple of specific things with the overall proposal. I guess also kind of teeing on what Jacob just said, is the goal here to provide elements that help where there's existing transit-oriented developments, and kind of how that gets improved to improve those connections and make sure that we're making the most of that? Or is it also how to increase transit orientation of development?
Yes, yes, and yes. So I want to be clear with this. This is multimodal in nature, so this applies more than just to our transit corridors. So this is beyond like the BRT projects that we're working on, all that kind of stuff. This is whether you can bike from point A to point B as well. So that's important to note with this. We're battling with that a little bit as we work through the project at the moment. Do we want to provide just base zoning code standards that are simple and applicable and easy to read for all of our different communities within those typologies, or excuse me, those contexts? Or do we want to provide specific zoning code overlay language or recommendations? Both of those come with positives and negatives. We don't want to just kind of shoehorn in a bunch of overlays within a community and make a zoning code incredibly confusing and laborious, and have language that is at odds in one section with another. And that can be a challenging undertaking too, making sure that your zoning code is uniform in that method. From the same coin, if we provide base standards, we don't want those to be so basic that they are just at the end of the day standards, and not actually providing guidance on how to specifically update those during that process too. So to answer that, it's going to be somewhere, I imagine, in the middle of that, but that is some tough conversations that we're going to have with both developers and the staff doing the actual work at the local level to determine there might be just specific little components that we can provide assistance with and take this toolkit to different local communities, and easy wins, for example, that even get them started, that we're going to have, and then have that wide breadth as well. So we are figuring that out, and that's something we're going to have to continue to engage local communities on.
Best of luck with that. It's really complicated. I think we see a lot of, there's kind of a chicken or egg issue with transit orientation, with multimodal transit, in terms of, do you need the density first? Do you need the access first? You know, and it's probably that we need all of it, and we can kind of sort out how the rest of it works from there, but is really difficult. So thank you for engaging in that. Another question I have is or actually a couple of comments. One is the developer roundtable, I think, is going to be incredibly important. And so the earliest that can happen, I think, would be great. It sounds like it's happening in 2026, but yeah, if it's towards that earlier end versus more towards that April. And I say that just because it's working with local governments, and it's what their codes are doing, but ultimately, very few cities are developing this infrastructure themselves. It's coming from private development, including us in affordable housing. Whatever's new that's being developed, we're the ones improving the sidewalks and the connections, and it's coming on that parcel by parcel basis, which is not ideal, but that's where our funding is at the current moment. So that's another question for another day, but just that because those are really the implementers, I think getting their feedback about what they can and can't do and how that's, if this toolkit is actually going to lead to things actually happening, it's be really critically important to engage them early and often, I think. Another piece is just that you talked about complete streets, and I just want to share that I've had that experience a few times here in Denver, and I can't imagine it's unique to Denver in that we'll have great guidelines and design on the surface and not have the same level of engagement with what's happening on the subsurface. At the public works level, planning in advance for where the sewer lines are going and easements and things, and so we can have this beautiful thing that we say is going to be multimodal, but if we didn't put the pipes at a deep enough depth, we can't actually get this beautiful complete street on the surface. So I think it's critically important to make sure that those are highlighted as linked and are not two separate processes, because that's where we often, again, in implementation, don't get to what we intended. Yeah, comments, thanks.
I appreciate that, thank you.
Other comments? Mr. Guzman?
Sorry, on that note, thank you. Please keep transportation involved in this. RTD's buses are expensive and they get damaged when we don't think these things. Turning radiuses are important. I'm thinking about Sun Valley specifically, in a project that both causes damage to city infrastructure and to RTD buses when we make certain turns down on the Route 15 in Sun Valley. But it's a result of exactly what you were talking about, Director Clark. Like, we have to be a part of that conversation. So that in this, that there is advice to that. And for wherever you're at in the region or whoever is providing mobility for public transportation purposes, because some of the region is outside of RTD, so it's something that needs to be considered. And our weather affects how we can maneuver on those streets in large vehicles. So I'll just leave it there. Thanks.
Absolutely, thank you.
Thanks. Are there any comments or questions? All right, Cole, thank you very much for your time.
Thank you.
Thanks for a great discussion, everyone. Next is our Ride Alliance Stage 1 project update by our Senior Project Manager, Mallory Miller.
Hi, everyone. My name is Mallory Miller. I'm a Senior Project Manager here at DRCOG. Just want to give you a heads up, I do have a long title slide. So I'm excited to talk with you all about Ride Alliance today. So Ride Alliance is a very long-standing project in the Denver region. This first started, I think, over 15 years ago. And then the project last had funding in 2020. So DRCOG was fortunate to identify a funding opportunity through the Department of Transportation to bring this project back to life. So the Department of Transportation established a discretionary grant program called the Strengthening Mobility and Revolutionizing Transportation, or SMART grant. This is an innovative grant opportunity that's awarded to innovative transit projects across the nation. What's great about this grant is it's also a two-part grant. So Stage 1 grants are awarded to projects to help build and test a proof of concept, and then Stage 2 grants are focused on implementing your project at scale. So DRCOG is currently in a Stage 1 grant. So why did we apply for funding and bring this project back to life, and why are we still working towards this 15 years later? Well, in 2024, there were 11,966 trip denials from DRCOG contractors. So this data just comes from 4 transportation providers, so it does not capture the entire need in the region. So this is basically 12,000 times that an older adult couldn't get to the grocery store to get food for the week, couldn't get to their doctor's appointment that they've been waiting months for, or wherever else it is that they needed to go. Additionally, right now, there is no coordination between transit providers. So the burden is on clients to understand what transportation options are available to them, how far in advance they need to call to schedule a trip, if they have to pay for that trip, what types of trips are available, Additionally, a lot of providers have very specific service areas based off their funding. And so a lot of times clients might need to coordinate between two different transit providers to get to where they need to go. So the burden is on clients right now to navigate and understand the transportation options available. Additionally, a lot of providers in the region right now also have a wait list for services. And the reason why they have a wait list is because our older adult population is rapidly growing. So in just less than 5 years now, Colorado as a state will see a 27.8% increase in the older adult population, which is about 1 in 5 people over the age of 60. So we are one of the most rapidly aging states in the nation, and so there is an urgent need to help reduce those trip denials and make it easier for older adults, people with disabilities, and other vulnerable communities to get to where they need to go. So the chart on the right shows what it would look like for different transportation providers to coordinate with each other without something like Ride Alliance. So if you were to imagine that A, B, C, D, and E are all different transportation providers, it would require them to build a proprietary application programming interface, or API, in order to connect with each other. So let's say A is Via Mobility Services. Via Mobility would need to build a custom API to connect with providers B, C, D, and E. And let's say provider B also wants to connect in, so they also need to build 4 custom APIs. So in this scenario, the route of proprietary APIs gets very expensive, and eventually it's not sustainable because there are too many custom APIs to be built, and so there is a limit to how many transportation providers would be able to coordinate with one another. And so that's where Ride Alliance comes into play. Ride Alliance aims to create a coordinated system for accessing transportation services by developing the Trip Exchange Hub platform. So the Trip Exchange Hub is an open source platform that operates off of transactional data specifications and allows providers to continue using their preferred scheduling software and still be able to connect into the system to exchange trip and client information. And what this does is it'll create a no wrong door approach for clients seeking services. So a client can contact any participating provider, say, I need a ride, and even if that provider can't perform their trip, they can submit it to the Trip Exchange Hub for another provider to claim. So in this scenario, a client only had to talk to one staff member, only one staff member had to take their demographic and trip information down. Without something like Ride Alliance, that client would get a phone number to call, and then they would call a second transportation company, give them all the exact same information again, which increases both staff and client burden. So Ride Alliance at scale will also allow us to maximize our available resources in the region and eliminate the silos that a lot of providers experience through their funding, because it allows for easier coordination of those multi-stop trips. So in the image on the right, this shows what the Trip Exchange Hub would look like at scale. So providers A, B, C, D, and E are all able to connect into the Trip Exchange Hub through a single open API. And let's say provider B were to make a change to their software. We only need to update this one single API, and it can communicate that change to all other providers. So this is a much more sustainable, cost-effective scenario, and there's almost limitless providers that can connect in through the use of the Trip Exchange Hub and transactional data specifications. So as we've been working through this project, it has not been without challenges, of course. The main challenge, honestly, has been just how short of a period of performance these Stage 1 grants are. So we only get 18 months to test and pilot this project, and about 6 months were spent going through the procurement process, hiring a staff member to lead this project, and then going through the RFP process for consultants for development work. So we've really only had a year to bring this back to life. Another challenge has been scheduling software companies lack incentive to adopt these transactional data specifications. So just a quick side tangent on transactional data specifications. Those are a type of data standard specific to human service transportation providers. So for example, the airline industry adopted the data standards like 2 decades ago, and that allows for things like Google Flights, Expedia, Booking.com to all exist. Now you can log into these websites and see all the different airline options available to you. You don't have to go on to, each individual airline's website to plan your trip. And so transactional data specifications aim to bring that same data standardization to the human service transportation world. So scheduling software companies, a lot of them offer proprietary solutions for coordination. So they want you to all buy into their software, and then they'll make it easy for you to coordinate with other providers. Fortunately, we anticipated this, and so I'll share a little bit later on in this presentation some alternatives that we prepared for. The last kind of major challenge that we face is just the gap in time since this project last had funding, which was 2020. So in the last 4 years, conversations around Ride Alliance and coordination have more or less paused. And a lot has changed in the region. Seniors Resource Center was a huge provider of transportation. They closed down during the COVID pandemic for transportation only. And then the Area Agency on Aging at DRCOG established a transportation program that uses Uber, which is on-demand providers weren't considered in the previous Ride Alliance model. Additionally, the last time this project had funding, we were working with a software called Route Match. And so a lot of the development work was completed specific to Route Match. So we had to redo a lot of that development this grant cycle. So just as a quick refresher of what we're working towards this stage, our goals that we identified in our application were to secure memorandums of understanding from transportation providers agreeing to participate in the pilot of the Trip Exchange Hub. We needed to upgrade the Trip Exchange Hub to kind of redo some of that development from last phase. We also wanted to make it compliant with transactional data specifications so we can start to develop a regional data standard for those human service transportation providers. We wanted to enhance the Trip Exchange Hub reporting capabilities to make it really easy for providers to pull reports needed for their funders or presentations or whatever else they need it for. We also wanted to update the user interface so it was a little more clean and functional for staff when accessing the Trip Exchange Hub. And then we wanted to implement a direct trip booking feature, which would allow providers who weren't able to be integrated via an API to just directly book trips in the hub. Our final goals were to integrate the hub with other transportation providers and then, of course, pilot all this work with at least one transportation provider and one trip type. So just to kind of update on some project progress. So thus far, we've completed, a lot of engagement and outreach. We've reconvened our stakeholder work group and are meeting on a roughly quarterly basis. We have secured memorandums of understanding from providers agreeing to participate in the pilot from the North Front Range MPO, who has, through their Ride No Co program, RTD's Flex Ride service, and then Via Mobility Services. Additionally, we'll also be piloting this project with DRCOG's Area Agency on Aging Transportation Program. We have completed development of the Trip Exchange Hub. So the hub has been made compliant with those transactional data specifications. It is open source, so others in the nation can look to this model and replicate it. We have enhanced the reporting capabilities. We have a really awesome user interface. And we're pretty much in the testing everything to make sure it's all going to go well when it comes time for the pilot. Some additional project progress that we hadn't anticipated when first applying is we have built an API with Uber Technologies. So this was done thanks to the AAA, the Area Agency on Aging Transportation Program. Uber is one of the providers that they work with, and it is the most popular provider option that clients choose to use. So we're excited that we have a direct API with Uber and the Trip Exchange Hub. Additionally, as I'm going back to what I had mentioned earlier, where some scheduling software companies are unwilling to adopt these transactional data specifications, so we have prepared alternatives for providers to connect into the Trip Exchange Hub, even if we aren't successful with getting that direct API. So those two alternatives are, one of them is called middleware. Middleware is very similar to an API. It basically acts as a data translator. So it'll translate that data before it hits the Trip Exchange Hub so that it's all compatible. The other thing we developed is a direct trip import tool. This is basically a very fancy Excel spreadsheet, but what's great about this is any provider could just enter information directly into this spreadsheet and upload it to the hub and still participate in the coordination of trip scheduling. So for our pilot, which we are 3 weeks away today from the pilot, so coming up really soon, our goal is to test 100 one-way trips. We also want to have just one interregional trip between the DRCOG and North Front Range MPO regions. We just know that there is a need for some folks to get between our two regions, so excited to test this out. We're aiming to have clients be satisfied with this experience. We want it to be smooth. We want to keep this going. So we'll be reaching out to clients after they've completed their trip to evaluate how this went for them. And we'd like clients to be, at least 90% satisfied with their experience. And then we're also aiming to have 99% or 2 nines of availability. So this is a technical term that refers to how much downtime the Trip Exchange Hub has, or like time where staff can't log onto the website and perform services. So 99% is about, I think, 14 minutes a day of downtime, so pretty little. And then, of course, we want to improve the functionality of the integration options. We want to make sure that API with Uber works. We want to make sure that direct trip import tool works for providers to upload trips. And so our remaining steps, these next couple of months, we have 3 weeks until the pilot, 3.5 months left in the project. We need to finalize our contracts and letters of intent from providers for our stage 2 application. We, of course, are going to be piloting this project. We also have some data analysis we'll be doing throughout the pilot just to, help track our progress and make sure we're hitting our performance measures. The pilot will conclude in December, right before the holidays, so it'll be about a 6-week pilot. And then, of course, we're going to apply for stage 2 funding. That stage 2 NOFO is expected to come out this fall. That might, be delayed a little bit given changes, but we anticipate that we would find out about those funding results in summer 2026. And just to kind of end on what we're really working towards and why this is so important. So our vision for Ride Alliance, at scale, after we've gotten that stage 2 funding and this is all done, is we envision we'll have a coordinated transit network with providers with agreed upon business rules for what types of trips we will exchange, what types of clients can be submitted to this Trip Exchange Hub. We envision this will be an efficient and cost-effective network that's able to optimize based off demand. So if we notice, that there are tons of people who need to go to this King Soopers every Friday, we can look into implementing a circular, some more cost-effective solutions to help get folks to where they need to go. We envision this will be a one-stop shop for transit services with the potential to expand to other service types. This type of model doesn't need to be unique to transportation. This could be expanded towards nutrition services, caregiver services. It's all about, creating a model to allow providers to coordinate with one another. And then last couple things is this will be a replicable open source model with the potential to expand statewide, the potential for others in the nation to replicate what we're doing. And then at scale, the Trip Exchange Hub will remain compliant with those transactional data specifications and remain sustainable to change, which we know will inevitably come in the region. All right, thank you, folks. Any questions or concerns?
Thanks, Mallory. Thanks very much for your presentation today. I'll open it up for questions and.
Thank you. Could you explain a little bit more about how this would, talking about an app that would go on your phone?
It would be great to have a mobile app in stage 2, but that's not something we have planned for at this time. So right now, this is a website, essentially, that providers would log into. And then in stage 2, we would also explore building a client-facing website option so that clients could directly book their trips and it doesn't always have to be on staff to coordinate this.
So could this then also include like RTD bus schedules?
Yeah, we have, well, RTD FlexRide will be one of our test pilot providers, which we're really excited about. And then we have, started conversations with the Access-A-Ride program as well, but that would be a stage 2 thing as well, because with Access-A-Ride, there's additional driver training requirements that we would need to put into consideration.
But you're envisioning down the road that a client would be able to put an app on their phone, access any of these.
If we are successful with that stage 2 funding, I do anticipate that we would put in funding for a mobile app, because it would be ideal to have both a website option and a mobile app. But I would say for sure we will definitely have the website option, plus clients will be able to call any of those participating transit providers, which for the clients who aren't as tech savvy, it's good to just have a variety of options for requesting trips. So ideally, would like to have both, yeah.
Sounds promising. It sounds like we need.
Other questions?
Thank you for a presentation and really good undertaking. So for stage 2, and you're talking about going statewide, I just recently have been working with a seniors home or residential facility, and had been surprised at how many were using Mustang or were interested in it. So one was going up into the hills to visit his son, another one has family in Fort Morgan, and one even uses it to get to St. Anthony's because it's an express ride from downtown. So just making a plug for including that, because it's so well integrated into RTD system at Union Station and so forth.
I appreciate you mentioning that. That is definitely on our radar for stage 2.
Thank you, Chair. So again, just to provide a real world example, when you book a flight, what do? You don't check 7 different airlines, right? You use Expedia, you use Kayak, you use Google Flights, you use one of those aggregating services that has a back-end database that finds its way into all the airlines and besides Southwest and figures out their schedules and shows you a summary of all of your trip options in one place, right? So really what we're talking about is the back-end infrastructure for the providers to be able to do that with each other. That's the hard work. That's the hard work that Mallory's doing. That's what we're going to pilot in the stage 1 pilot, and then bring it to scale in stage 2. And then eventually we want to make that the other side of the coin, the public-facing side of the coin, whether it's a phone app or website or other way, that the user, the client, can just be able to go on and have that same effect. But that's really an example of what we're talking about. And if we can get there, it would be pretty darn innovative. And that's why it's taken so long and there's so much effort into it. But it would be pretty groundbreaking if we could get to that point with human service transportation.
Thank you. Other questions? All right, thank you, Mallory, for your time. All right, we'll move on to member comments and other matters, and we'll begin with Colorado Department of Transportation. We're over to Commissioner.
Thank you much. I'm glad Darius is here, because I wanted to put a plug in for his 2050 statewide transportation plan. It's just, we adopted it last month, and it culminated about a year's work, maybe a little bit more, with the most outreach we've ever undertaken. I think just for one little data point, at least 50,000 people tuned in for some portion of recent of town hall meetings that we had, across the state. So, and it's quite well done. It's an interesting document, a lot of tools, a lot of interesting graphs and things like that, dashboards. And then is a good thing to read in terms of seeing the direction that the different regions of the state are moving. And then finally, how we're preparing for the future for autonomous vehicles and things like that. So just putting in a plug for that. We're starting we're undertaking the new budget development, and we'll have a preview of some of that at this meeting. This coming meeting this week is on the road. We'll be in Glenwood Springs. The commission is going to take Amtrak actually up to Glenwood in order to sort of trace part of where Mountain Rail would go, at least to Bonn. It'll be a real hoot as well as informative. And then had the chance to go to a groundbreaking for Vasquez up in Commerce City. There's a place where like 4 different roads, 5 different roads come together, and it's a heavily trafficked freight route as well. In fact, my app, my navigator took me on a wrong turn because it's such a confusing area. So I think they're going to simplify that, make it a 4-way stop or a 4-way intersection, and that'll be better. And then finally, next week, Wheat Ridge is going to have a milestone sort of ribbon cutting on its project along Wadsworth between, I think it's 33rd and 44th. And so they'll have these, you know, just like there is down on Santa Fe, the continuous flow interchange or intersection at both 44th and 38th. So anyway, just wanted to mention that. It's in my area. Thank you very much.
Thank you very much.
Yeah, just to follow on to that, thank you, Commissioner Cook, on the kind words on the plan. I think we're going to move on to the last step of this planning cycle, which is the 10-year plan over the next couple of months. The only other item to mention is it may not seem like it here and sometimes in Denver, but we are moving into the winter season, so it's going to be snowplow season, especially revisiting in the mountains. So be careful with our snow plowers out there trying to keep the roads open for it. And no doubt they'll be in Denver sometime soon. So thank you.
Thank you very much. I will turn it over to Director Johnson for our RTD update.
Good morning. Thank you very much, Madam Chair. I'll start out and then you yield the floor to the directors that are assembled here this morning. First and foremost, I wanted to touch upon RTD's commitment to asset renewal and state of good repair. You may recall last summer we undertook construction relative to downtown, one of our oldest light rail lines, really our inaugural light rail line in the downtown core. When I was here in August, we talked about work commencing the day after Labor Day, being September 2nd, which is an 86-day project whereby we are doing a full depth reconstruction of the rail there. We are 37% complete as of Friday. This Sunday will require full closure of southbound Calumet between Spear Boulevard and Colfax. The agency is in close communication and coordination with stakeholders in the work zone there, and closure information will be provided midweek. We have a landing page that is dedicated to downtown rail reconstruction. We have been sending out weekly notifications, providing updates on where we are. Very proud of that work and the integration of that, showcasing the weeks and talking about the work that has been done. Another critical element that we're proud of really with our partners with the City and County of Denver and Downtown Denver Partnership following the grand reopening of 16th Street that took place last Saturday. The 16th Street free ride, since mall no longer exists on 16th Street, we resumed service along the historical path between Denver Union Station and Civic Center Station. And it was really exciting for me because I've been here for 5 years and the corridor has never been open in my capacity of my position. So it was such a celebratory event, and it really highlighted all the collaboration that has gone on. And I know the downtown is, if you haven't been down there, it's really great in reference to looking at all the foot traffic and all the different pop-ups and just engagement activities as a whole. So for those that aren't familiar, our free ride basically runs from early morning to late night, and it varies maybe like 4 to 12 minutes in reference to the headways of services there. And it's one of our most utilized bus routes. When you think about January of this year through July of 2025, we had 1.2 million boardings year to date, and that was only 7 months. And so we're averaging more than 170,000 monthly boardings as compared to 125,000 monthly boardings in 2024. So the resurgence in the utilization speaks volumes. Another critical element I'd like to touch upon quickly is the Finishing Fast Tracks report. Staff has released the draft Finishing Fast Tracks report, and that's required pursuant to SB 24230, which prioritized the completion of Northwest Rail and North Metro corridors currently served by the B&E lines. B and N lines, respectively. And the reporting requirement in SB 230 was amended by SB 161, thereby extending the time frame in which we needed to submit a report, which is December 1st. And so including among the report's primary takeaways are the fast track program completion costs have increased substantially over time. And that's not to be doom and gloom. It just means that we can leverage partnerships as we go forward, which I believe are analogous to what we've been doing with the state relative to joint service intercity passenger rail that we're currently looking at. And more to the point, new funding and partnerships will be required to complete the program by 2034. One thing that I want to share is that we've embarked upon a very rigorous outreach and public engagement cycle. It started on October 1st, whereby we launched our web page. So anybody that would like to make public comments, you can go to our website. And that closes on I don't know why I'm having a trouble this morning. Friday, November 14th. I have just moved us into 2026. It's bad enough the year's going to be over in a second. I have just catapulted all of that. Tomorrow evening, our staff will be at DRCOG's board meeting presenting this. And so we just have a myriad of different activities. We had an initial discussion with RTD's board on September 30th. And we have an additional engagement on October 28th, recognizing when the report is due, which is December 1st. It's coupled in there with the holidays. We anticipate submitting it to the state November 25th. So with that, I'll yield the floor to my colleagues should they have additional information they'd like to share.
Thank you. Just two things. There's an awful lot going on. But one, I just wanted to touch on the accountability. As you know, there's 15 RTD board directors, and I think all of us have a separate opinion as to what the board might look like. But the accountability committee is making progress and talking about the possibility of maybe having 7 to 9 elected directors and maybe 3 are it might be a mixed board. They're going to be coming up with a recommendation in, I think, 18th. A recommendation down to the state legislature. Of course, they've got some other things that they're doing. Personally, I'd be very open to some sort of reform of the board. We need to make decisions quicker, more efficient, whatever. To piggyback onto the Fast Tracks report, really would encourage you to. I've submitted my suggestions and recommendations and possible changes. I'm hoping that others will take a look too. We have until Friday, November 14th to accept public changes, suggestions, perhaps compliments, whatever. The actual report is only about 48 pages long, but there's a lot of good attachments to that report, including the 2018-19 unfinished Fast Tracks report, which provides a lot more information. But if you've got time, inclination, please take a look at it and contact us and give us your thoughts. Thank you.
All right. I will turn the floor over to Director Silverstein for the Regional Air Quality Council report.
Yes, thank you. And only one thing to report out today. Our board of directors is now in the consideration process for what we call our emission control strategy blueprint. This is the staff's proposal to our board based on quite a long, extensive stakeholdering process to come up with a strategic plan for the RAC and our region to evaluate new emission control strategies to improve our summer air quality, improve ozone concentrations. We had an excellent year this year. Kind of the weather cooperated. Our meteorology was one of those summers that we recorded some of the lowest ozone concentrations we've ever had. And we hope it's a combination of that favorable meteorology and the emission control strategies already in place, but we need to do more. And so we have our control strategy blueprint in front of the board for consideration in November. And then if the board gives us their approval or their endorsement, then we move out with our stakeholder community and further fleshing out additional emission control strategies, whether they be voluntary, incentive-based, or regulatory options. And so that's really the report from my office, and happy to answer any questions about the blueprint.
Very much. Are there any comments or questions from any about anything on these? Make sure you see Cam to get your parking pass. Our next meeting is November 18th at 9:51. Thank you, everyone.